Today we're going to touch on the research study that we read about that was using a skills training approach, STA, to improve postpartum maternal functioning. So this study is relevant to all of us as it explores structured skills group and how that can enhance psychological well-being and self-efficacy. So we're going to start by looking at the study itself, breaking down its findings, understanding what a skills group is in counseling. We'll look at how skills groups compare to psychoeducational groups, and then how we can apply these methods in our various settings. So we're going to start again with that overview of maternal functioning and why postpartum support is crucial. I lie. I'm actually going to start with SPA approach. So the skills training approach is a counseling method that focuses on developing practical skills rather than just discussing problems. So STA is structured and includes role playing, practice video modeling, um, guided real life applications, things like homework and practice assignments. And it's been widely used in mental health counseling for anxiety, depression, PTSD. It can be used in school counseling to teach emotional regulation and conflict resolution. Healthcare settings have used it for postpartum care and chronic illness management. The goal is to equip participants with tangible strategies that they can implement in their daily lives. So the study was that we read about was a randomized controlled trial designed to assess how counseling with structured skills training could improve maternal functioning. And the intervention group received 4 weekly skills building sessions, while the control group received only routine postpartum care. To measure results, the researchers used the Barkin Index of Maternal Functioning, which is a tool that assesses self care, infant care, emotional regulation, and adaptation to motherhood. And the study found substantial improvements in the intervention group across all domains, which we're going to explore. So just a little bit here, when we're talking about postpartum period, that I think we know that, but just in case, it's a transition phase that comes with physical recovery, emotional shifts, and increased responsibility. And mothers often experience fatigue, hormonal changes, social isolation, and identity shifts. And research suggests that maternal functioning includes several domains. So things like self-care, which is eating well, sleeping, managing stress, infant care, which is feeding, soothing, bonding, psychological well-being, regulating emotions and reducing anxiety, social support, family, friends, and community resources, and adjustment, adapting to new roles and routines. So when mothers struggle in these areas, it can impact infant development, attachment, and family dynamics. So this study was exploring how a structured skills training intervention can help with all that. So as I mentioned already, it consisted of 4 weekly counseling sessions, and the first session covered self-care and infant care, while the second session focused on mother-child bonding and psychological well-being. The third session explored social support and management strategies, and the final session reviewed progress and provided feedback. So these structured topics ensured a comprehensive approach to improving maternal functioning. So some key findings. As I already said, the intervention group saw significant improvements in every aspect of maternal functioning. So, by focusing on skill development, mothers were able to improve self care routines, strengthen bonding with their infants, and enhance emotional regulation, as well as build support networks. So, this suggests that skills based counseling, in this case, was an effective strategy for maternal mental health support. So, a skills group is a structured form of group counseling where participants learn and practice specific coping strategies. And unlike traditional therapy, where clients reflect and process emotions, skills groups are action oriented. And, therapists do use things like role playing exercises, guided discussions, modeling behaviors, home practice assignments, as I said. And these techniques help participants internalize these new skills and apply them in real life. When facilitating a skills group, the focus is on practice over discussion. So, unlike traditional talk therapy, skills groups require structure, guidance, and active participation. The key components of a well run skills group include a structured format. So, each session should have a clear agenda, ensuring participants know what to expect. There should be active participation, so clients should be encouraged to practice rather than just listen. Um, Modeling and role play. So the facilitator first demonstrates a skill, then invites clients to practice it in a safe environment. Feedback and reflection. So after an exercise, participants should reflect on their experience and receive constructive feedback. So real world application is assigning homework or practical exercises that ensures the learning continues beyond the group. Skills groups should have a clear and consistent structure to maximize effectiveness. So you want to start with a quick review, maybe like a check-in and looking at last week's homework and check on parents, participants' progress. You want to introduce today's skill, explain its importance in demonstrating it. Clients role play, act out, or apply the skill in real time. So leave some time for practice and then have some feedback so that members can reflect and offer supportive feedback to each other. Give the homework assignment. So, again, that real world application exercises that you want completed for the upcoming week. And so, again, this is a very hands on approach, ensuring that skills are not just learned but applied. Though they may seem similar, skills groups and psychoeducational groups serve different purposes. In a skills group, the emphasis is on practice and real world application, and participants actively engage in exercises, role playing, and structured activities that allow them to build and refine skills over time. The facilitator models behaviors and gives coaching and feedback to help participants develop confidence in their abilities. So, by contrast, psychoeducational groups focus on increasing knowledge and awareness. The facilitator presents information, leads discussion, and provides resource, but there's less emphasis on active practice. So these groups are great for educating individuals about anxiety, grief, parenting strategies, or mental health conditions, but they don't necessarily equip participants with hands-on techniques for immediate behavior change. So both types of groups have important roles in counseling. Skills groups are ideal when the goal is behavior modification and applied learning, while psychoeducational groups work best when the goal is increasing understanding and insight. There are many types of skills groups used in mental health. So I'm going to just mention some common ones like DBT skills groups used for things like emotional regulation, distress tolerance, mindfulness, and interpersonal effectiveness. There's anxiety management skills groups, which teach relaxation skills, cognitive restructuring, and coping strategies. Social skills groups, which can help clients improve communication, assertiveness, and conflict resolution. We just read about postpartum mental health groups, which focus on maternal adjustment, self care, and emotional well being. Trauma-informed coping skills groups, which provide tools for managing PTSD symptoms and emotional flashbacks. So each type of skills group is structured to meet the specific needs of its target population. In school counseling, skills groups could help students navigate academic, social, and emotional challenges. And so some examples could be that emotional regulation group, so to teach students how to manage stress, anger, and frustration, or conflict resolution and peer mediation, which can help resolve interpersonal conflicts before they escalate. A study skills and time management group, which could equip students with organization and planning strategies. A self-esteem and assertiveness training, which would build things like confidence and communication and self-expression. A college and career readiness group, which would prepare students for applications, interviews, and career exploration. So, by using skills based interventions, school counselors can proactively support student development. A DBT skills group is designed to help individuals who struggle with emotional regulation, distress tolerance, and interpersonal difficulties. So, this group is widely used for clients with borderline personality disorder, mood disorders, and high emotional reactivity. Sessions typically focus on four key skills areas. So mindfulness, teaching participants how to stay present and reduce emotional overwhelm. Distress tolerance, helping individuals cope with crises without making impulsive decisions. Emotional regulation, so training people to manage intense emotions effectively. Interpersonal effectiveness, so strengthening skills for assertive communication and boundary setting. So, for example, a participant might role play a difficult conversation with a family member and receive real time coaching on improving tone, word choice, and assertiveness. So, this hands on approach makes DBT skills groups particularly effective. Um, Okay, and so here's another example of social skills group training with adolescents. So in this case, adolescents maybe will be practicing making eye contact, engaging in conversations, and handling peer pressure. Um, this is perfect for perhaps for adolescents who are struggling with making friends or handling peer interactions or managing social anxiety. So they could practice real world social scenarios through role playing, practicing introductions, handling disagreements, or initiating small talk. They could get peer feedback to receive supportive critique on body language, tone, and engagement. There could be video modeling where they're watching and analyzing examples of effective and ineffective communications. So, for example, a student with social anxiety might practice starting a conversation in a low pressure environment, then receive constructive feedback on what worked well and what could be improved. And over time, this builds confidence and comfort in social interactions. So, anxiety is one of the most common concerns among college students, impacting their ability to focus, engage in class, and succeed academically. So, an anxiety management skills group would teach students relaxation techniques, so practicing deep breathing and progressive muscle relaxation to reduce stress responses. There could be some cognitive behavioral tools, learning to reframe anxious thoughts, in other words, changing ideas like I'm going to fail this exam to I've prepared and I'll do my best. I literally just did this with someone the other day. Um, Gradual exposure, encouraging students to face anxiety-provoking situations in controlled environments, like practicing public speaking in a group before doing it in class. Or a student with test anxiety might learn to recognize physical signs of stress, apply a breathing technique to calm down, and restructure negative thoughts about failure before an exam. So over time, these strategies can help students feel more in control of their anxiety. Um, a conflict resolution skills group is ideal for students who struggle with arguments, anger, or peer relationships. So, this group could focus on practical strategies like using I statements like I feel upset when instead of you always, practicing de escalation, so learning to walk away from tense situations, mediating conflicts, so helping peers negotiate resolutions. So, for example, in one session, students might role play a disagreement between two friends and practice calming techniques, active listening, and compromise. And these skills help students navigate conflicts more effectively, reducing aggression and improving relationships. In this slide, I'm introducing the concept of offering the same intervention anxiety management for college students as either a skills group or a psychoeducational group. Both approaches are valuable, but they serve different purposes and produce different outcomes. So, a skills group focuses on real time practice of anxiety reduction techniques, as I mentioned, helping participants actively learn coping strategies, whereas the psychoeducational group provides theoretical knowledge about anxiety and coping strategies but most likely does not include a lot of hands-on practice. So to help us fully understand the difference, we'll now explore each approach separately, beginning with the skills group model on the next slide. So I know this is redundant, but I want to make I want to contrast the difference. So in a skills group, participants are actively engaged in learning, practicing, and applying anxiety management techniques. in this example. So the facilitator structures the session to guide participants through hands-on exercises, ensuring that they leave with tangible tools they can immediately apply in daily lives. So a typical anxiety management skills group session would include maybe a check-in and a warm-up where participants briefly discuss their experiences with anxiety since the last session and what strategies they used. It could include a skill demonstration and group practice where the facilitator leads a progressive muscle relaxation exercise, encouraging participants to observe their physical sensations before and after the exercise. There could be a 20-minute interactive exercise like thought restructuring, where participants identify a recent anxious thought, work in pairs to reframe it, and share experiences. A gradual exposure exercise where participants take turns delivering a 1-minute speech in front of the group to practice managing public speaking anxiety. And again, the facilitator is providing real-time coaching to help regulate physical and emotional reactions. So then we'll close in this type of group with a wrap-up and homework where participants might set goals for the upcoming week and complete a self-monitoring worksheet tracking anxiety triggers and responses. So again, unlike in a psychoeducational group, here participants are not just learning about anxiety management, they are practicing and mastering coping techniques in a supportive environment. So I'm creating an anxiety management group through a psychoeducational lens here. So let's look at that is so that again, that not to confuse you, I'm just trying to make the distinction because they're similar. So it's more focused again on providing information and increasing awareness in this case about anxiety rather than hands-on practice. So the facilitator in this case plays more the role of an educator rather than a coach, and the structure is more lecture based. A typical anxiety management psychoeducational group would include maybe a 20-minute intro lecture, even a PowerPoint presentation. I mean, maybe that would go over the biological and psychological causes of anxiety, common symptoms and triggers of anxiety, and a brief overview of common coping strategies such as mindfulness and cognitive restructuring. Then there might be a 15-minute group discussion where participants share their personal experiences with anxiety and discuss how it affects their academic and personal lives, and then a review of coping strategies where the facilitator explains strategies such as deep breathing, meditation, and cognitive restructuring, but there's no in-session practice of these techniques. And then possibly a 10-minute Q&A at the end where participants ask questions, but again, there's no hands-on engagement. A closing might include handouts where participants receive informational resources and are encouraged to apply the strategies on their own time. So this group provides valuable knowledge, but unlike the skills group, it does not offer the structured practice or real-time skill building.
Okay.
So the key distinction between an STA-based group counseling approach and a psychoeducational group lies in their structure, goals, and depth of interaction. So by now, we all know that psychoeducational groups primarily focus on delivering knowledge and teaching skills with a more structured instructional format. And these groups emphasize information dissemination, such as explaining anxiety symptoms or providing parenting techniques. Interaction is often limited to questions and discussions based on the material presented, whereas STA and group counseling, as I outlined, deals with an integration of experiential learning with a direct skill application. And so instead of just teaching concepts such as what I just mentioned happens in psychoeducational groups, STA emphasizes skill building through active participation, modeling, role playing, as well as personalization and adaptation to individual needs within the group dynamics. There's reinforcement through homework and real world application rather than just providing knowledge. Um, and uh, I would say that while STA contains educational elements, the difference is that it actively engages participants in learning by doing, which makes it a therapeutic group rather than purely psychoeducational. So, the decision to use a skills group versus a psychoeducational group depends on the goal of the intervention. If we want participants to actively develop coping strategies, we should use a skills group where they can practice in real time. If the objective is simply to educate individuals about anxiety, a psychoeducational group may be sufficient. In many cases, a hybrid model is most effective, starting with psychoeducation to introduce concepts, then transitioning into skills based exercises to reinforce learning.